Hi everybody, Nas Sharon here and welcome to our medical vlog. Now today my colleagues and I are going to be demonstrating 5 important infection prevention and control procedures, and we are starting off strong with hand washing. Now here you see Nurse Martha is going to open the tap with her hands, first the right and then the left, and then she will apply enough soap to cover all hand surface, just like that. And then she's going to rub her hands palm to palm, and then right palm over left dorsum with interlaced fingers, and then vice versa, and then palm to palm with fingers interlaced, just like that. And then backs of fingers to opposing palms with fingers interlocked, just like that. And then rotation of thumbing of left thumb clasped in right palm and vice versa. And then rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and then vice versa. And then she is going to rinse her hands with water, just like that, from the top to the elbows, ensuring all the soap is off. And then she's going to grab her towel by the corner, just like that. She's going to use one corner to dry the front from the palms to the elbow. She'll use the same part up the other corner from the top of the fingers down to the elbow. Then she'll grab the other corner of the towel, use it to dry the other hand from the palm to the elbow. She'll use the other corner to dry from the top to the bottom, just like that. She'll use that same towel to close the tap since it's still running, like that. Then once that is closed, she will dispose of that towel into the dirty linen container, just like that. And then she will raise her hands, and now she's safe. Alright, so next we're going to be looking at donning sterile gloves, and this is going to be performed by Nance Favor. Alright, so she's going to show us the size of the gloves, the expiry date, and the tear of section of the glove above there. Okay, so now for extra precaution, she's going to be sanitizing to kill off any microorganisms that might have escaped to ensure maximum safety, just like that. Alright, so now she's going to pick up her pack and she's going to open it from that tear of section, and we are not allowed to touch the inside contents of that pack, so she's not going to touch it. She will rip it open and she will just throw it onto the sterile field. Then she will discard of that pack, and then she will use the foldings of that pack to open. We're not supposed to touch the gloves themselves. We need to avoid that at all costs. Alright, so now she's going to dress her dominant hand first. We can touch the inside of the glove, just like that. So dominant hand first. And when the dominant hand is worn, she can now touch the outside part of the glove, and she will wear onto her non-dominant hand, avoiding touching the inside of the glove, since the outside is the most sterile. So she will adjust the gloves and make sure that they're sitting on her fingers just right. Alright, and now that that is done, she will interlock her hands for safety. Alright, next we have waist segregation, and this is a 2-nurse procedure. One nurse will be holding the waist and the other will be segregating. So you can see that our nurses are protected, extra protection. We're wearing a hairnet, a mask, an apron, and gloves. So we have the black bin, the red bin, a gray bin, which is a replacement for the brown bin, and a sharps container. So in the black bin, that's where we put our organic waste, things like food, like wrappers and stuff like that. Then in the red bin, we're going to put all the hazardous waste, things that have bodily fluids, things that have blood from the patient, things like catheters, used NG tubes, used gloves, used gauze. Then in our brown bin / gray, in our situation, we're going to be putting our expired pharmaceutical wastes, like expired drugs. Then in a sharps container, that's where we're going to put things like broken vials and needles. All right, so that's waste segregation. Then next, we're going to be talking about dump dusting. This is still a TUNAS situation here, and we see that our TUNASes are dressed up in a protective way. We're not wearing one pair of gloves, we're wearing 2 pairs of gloves. We're wearing a face shield, an extra mask, we're wearing a hairnet, we're wearing an apron and gumboots. So as you can see how they're cleaning, they are not Nurse Medi is not going back. He's using a damp towel dipped in soapy water. So when you clean, you do not go back where you came from. You clean at once. It's a one direction kind of soap. And then we can see that our other nuns is still doing the same thing on the trolley. Alright, so we need to make sure that when you clean, you do not return where you came from. Alright, so here Nurse Medi is dipping the towel back into water, again wringing it completely in order to dry the table that he had cleaned. Still, again, it is a one direction swoop. We are not going back. Yeah. Alright, so once this procedure is done, the towel will be put into the dirty linen container, and then that dirty water that's in those pans will be poured into that green bucket, and then the gloves will be put into a red bin. Alright, so lastly we have equipment cleaning and preparation of sterile packs. So before anything is used on a patient, every instrument has to be cleaned properly to reduce the risk of infection and keep everything safe and sterile. So first the equipment is cleaned and checked carefully to make sure it's in a good condition and ready for use. We also use protective wear like gloves and masks to avoid contaminating the instruments during preparation. So after that, the sterile items are arranged and packed neatly like you're seeing using aseptic technique. Everything is folded and organized properly so that it stays sterile until it's needed. So the packs are then sealed, labeled, and prepared for sterilization in the autoclave, just like you're seeing the nurses doing there. During this process, nobody else is allowed to touch the sterile field apart from the 2 nurses that you're seeing in here. They're the only ones that are allowed to touch the sterile field because they are clean, they're sterile, and they're protected. So as you can see, they're putting the instrument into the autoclave. Alright, so proper equipment cleaning and sterile pack preparation may seem simple, but they play a huge role in infection prevention and quality patient care. And as you can see, our nurses are finally finishing up and doing their last touches. Alright, so thank you everyone for watching, and thank you to all the amazing nurses that participated in this video. I hope you learned something and I hope you'll enjoy it. Until next time, peace.